Thank you for taking the time to join us for this video with Professor Stefan Schug, entitled Opioid-Sparing Multimodal Analgesia. Inadequately treated acute pain following surgery can have both short and long-term consequences. Uncontrolled pain is the most common cause of delayed recovery or unplanned hospital admission, and can lead to the development of chronic pain. Studies have demonstrated that the severity of acute postoperative pain in the early days following surgery is highly predictive of the development of chronic postoperative pain. Optimal postoperative pain management should be implemented to potentially reduce the progression to chronic pain. Multimodal or balanced analgesia can be beneficial for the management of postoperative pain. Using combinations of analgesics with different modes or sites of action to target the pain pathway can improve analgesia and have an opioid-sparing effect by reducing opioid requirements, thereby reducing the adverse effects of opioids. Professor Schug will now highlight the key principles of multimodal analgesia and the benefits for patients as well as institutions.
There's one overarching principle, and this is we are not relying on one analgesic technique alone. And that has been called multimodal or balanced analgesia, and it is the combination of two or more analgesics with different mode of action or site of action. And if you do that well, choose your components well, then the multimodal approach over one single drug in a higher dose will improve postoperative pain relief. It will reduce opioid requirements, being opioid sparing. And if you are opioid sparing, you are also reducing adverse effects of opioids. And the reason for that is simple. The incidence of clinically meaningful adverse events of opioids is dose related. So if you use a technique which is opioid sparing, you are reducing the risk of opioid side effects, which would otherwise impair recovery and rehabilitation. And the reason why we want to avoid these is not only because they are unpleasant for patients, but also because they increase the length of stay in a hospital and they increase the costs. And therefore, the approach of multimodal analgesia is not only better for the patient with regard to quality of analgesia and less side effects, but also from an economical point of view. Now, if we think about multimodal analgesia, for me, the best way to think about it is follow the pain pathway and think what you can do. We have first the transduction, the generation of action potentials. What we can do here is NSAIDs or COX-2 inhibitors, reducing the inflammatory response and thereby the polar hypersensitization, the peripheral sensitization of the nociceptors. And we can use topical local anesthetics by infiltration. Once an action potential has been generated, and we can also go very close to the spinal cord and block the transmission. Once it has reached the dorsal horn of the spinal cord, we have to do an approach which changes modulation. And here we have learned a lot in the last 20 years. So we know now it's not only opioids and COX-2 inhibitors which work here, it's also ketamine as an NMDA receptor antagonist, the alpha-2 delta ligands, pregabalin and gabapentin, and alpha-2 agonists, such as clonidine and dexmedetomidine. Last not least, when the information has reached the brain, we can alter the perception of pain. We can do that with opioids, or we can do that with anti-inflammatory drugs. And this gives you a very good roadmap for what can you combine with what to achieve best possible multimodal analgesia. If you think multimodal analgesia, then you have to think three sentences. Minimize use of opioids, maximize use of non-opioids, and use regional anesthesia techniques whenever possible. Whenever you see a patient think about these three, then you will get it right. You can also look up what is the right approach, and if you do that, please use an evidence-based, procedure-specific guideline.
Opioid-sparing multimodal analgesia aims to improve pain control and reduces opioid consumption, thereby reducing the risk of opioid-related adverse events, and may reduce the associated costs to the patient and hospital due to delayed recovery and rehabilitation after surgery. Implementing multimodal analgesic techniques that are specific to the surgical procedure and target different aspects of the pain pathway help to optimize analgesia and improve postoperative outcomes for the patient, and reducing hospital stay, complications, and readmissions.